Hello, everyone. Thanks for joining us. And thank you, Dr. Praveen, for agreeing to be here and agreeing to share your knowledge. The amount of work you do in terms of keeping yourself updated is
Thanks a lot, Priti, because the people like you who starts giving questions, and we are definitely indebted, and particularly to this society called IAFM, you people are doing a great work. Uh, kind of honored to be here, Dr. Priti.
thank you, Dr. Praveen. So, Dr. Praveen is a medical graduate and a radiologist from Osmania Medical College, Hyderabad, working in the field of environmental medicine. हम सबको पता है कि हर कोई जो कोई काम कर रहा है हमारे पीछे एक कहानी है, राइट? एंड ऐसे ही डॉक्टर प्रवीण जिस पैशन के साथ ये काम कर रहे हैं एनवायरमेंटल मेडिसिन में, उसके पीछे भी एक मैं बोलूंगी बहुत ही हसीन और बहुत ही सक्सेसफुल कहानी है, ठीक है? He is a proud member of the Global Coalition for Autism Research Institute USA and an advisor to Akhil Autism and an advisor to Leadcon 2017 India, as well as the founder of the Universal Health Organization. Today, in this episode, I've requested Dr. Praveen to share his immense knowledge on how chemical causes are the reason for making 33% plus people diabetic today from the environmental perspective science. Guys, 33% plus. तो मजाक नहीं हो रहा है, right? Youngsters who are becoming diabetic, and interestingly, even 10 years back when I started Dr. Praveen working on diabetes because I reversed my own diabetes, right? It was much, much, much simpler to reverse diabetes than what it is today. And I would love to hear from you. What are your insights on this and why this change has happened? And what is it that we need to now be doing that this 33% doesn't become 66 in the next few years? Over to you, Dr. Praveen. You can share your presentation.
Yeah. Again, thanks a lot, Dr. Priti. And it's always good to be here. The thing is, I can always tell you what exactly I'm going to work it out here, because I was one of the doctors who belonged to, I'm quite senior in the sense we passed in 1990. And from there itself, during that time, I see most of my parents, my relatives, and all that. They were not very happy with that only allopathic approach. I belong from a family where we have a lot of things on music, and at the same time, they say, okay, you need to learn homeopathy also. So I said, okay, this is not my cup of tea once I joined my medical college. But I can tell you, nowadays, I see a lot of people telling that same story. I'm not alcoholic. I don't smoke. I try to be very careful with what the kind of oils I'm using. I'm exercising daily. And this sort of people are are on for a basically they are being treated by doctors like us. Ki chalo, come into the club of diabetes, and okay, we are also one of them, and join the club. So I always try to look at the kind of the numbers are really astounding. We need to know why. See, I try to compare 30 years back. Yeah, 30 years back is some time, but this is that particular moment. I'm talking about 95. We completed graduation in 90 and did my radiology later that, and I used to do a lot of ultrasounds and all that. We never picked up that fatty livers on normal ultrasonography. And whenever you used to have this something called fatty liver on the ultrasound, we used to tell, okay, you have some problems with your fat intake. Try to correct your things, and it will help you. But over a period of time, we realized we started following up that cases, and all of them they were having something called the pre-diabetic. They were having fatty liver. Priti, I am taking around circles because I see a lot of people having something like they are not happy because of their health issues. And they start looking at some answers. Some weight person says, okay, I will reverse your diabetes in one day. Somebody says you do this kind of things, and people are becoming guinea pigs because of this. They want to, at its kind of thing, they want to see. I have a very good I can tell you, most of the people are on the higher side, very intelligent people. The person gets into something like CKD and his glucose goes down and he says my diabetes is cured, doctor. So the thing is, it's really important thing. In particularly from an Indian perspective, we are the largest democracy, and we cannot afford people having ill health because of these stupid reasons. So I'll try to share my presentation here, and this is one thing which we always try. I'll okay. So we were, one second. I'm just uploading the file.
Please,
Yes.
Dr.
Yeah.
Praveen, till then, you've said
Ah,
two things which
yeah.
I want to re emphasize. One,
Please.
join the club.
Yeah,
Guys,
yeah, yeah, yeah.
we don't have to join the club of being a diabetic. We have to join the
Oh,
club of being energetic and being in peak wellness.
no, no.
But
I'm
you,
now I'm so confident. I want to take up the people who are non-diabetic and start researching on them. Why he has not become a diabetic? It's something like that now because this is
perfect.
so rampant. This is so rampant.
And second, Dr. Praveen, what you said, I always say. See, I did my MBA from IIM Lucknow and then used to sit in medical conferences, and everywhere there used to be one line: heart health capital, heart disease capital, diabetic capital. And I used to, hold like this on my chair because I used to feel so angry, so annoyed, I can't tell you. The simple thing is that we cannot become the economic power till we make sure that our youngsters are healthy, our parents are healthy, and we are healthy. So, if for nothing else, guys, I think it is extremely important if we want to get the recognition we deserve globally. If we want to be that economic power, if we want to be the country which people look up to, first and the most important thing is we need to make sure that we are not the capital for diabetics, not the capital for cancer, not the capital for heart health. And most of it today is coming from what Dr. Praveen is going to share with us right now.
Yeah, I think because we are good actually. We definitely crack good IIT marks and all. We try to work with the entire this one, but getting first in all disease patterns is really, it's not acceptable. I'm just it may take some more time. I will share. This is one thing I'm trying to share it.
Oh,
Yes.
you've shared it, and it is here.
Yeah, 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 yeah. So I'll just go. I think I'll try to work it out. Basically, my introduction is basically I'm a radiologist. I started working on something concepts called, as you rightly said, autism and all that. But at the same time, when I did my medicine during the first year of MBBS, I was started doing something like cardiology postings. Why? My dad was having some heart problem, so he was put in the ICU, and my mom used to be in the night duties she used to perform, and I used to go like I used to do in the nights actually. My mom was there, so I see a lot of mortality there, and I really realize ki, what is this going on. So something has to be done. As you rightly said, we are not sitting ducks, and we should not get ourselves as the guinea pigs. Why I'm telling this chemical cause of diabetics is everyone we tell Hyderabad may we are all talk very jovial. We का अरे मीठे हो गए means you have become turned diabetic or not. That's the kind of thing. My goal is to keep your diet environmental toxin free as possible, and prevent the disease and remove the dis from the disease. From if you remove dis from disease, it becomes ease. So that should be our focus. So the question, the kind of thing is diabetes may be a natural physiological response to a collective high toxic load. Can be because of overeating, reduced exercise, environmental toxins. I will try to focus more on this environmental toxins. What the thing what you breathe through air, food, as well as water, right? The solution to pollution is definitely, it is called, we have worked on this environmental, this one, it's called dilution. We see, I'm also putting on weight, I'm having something like IR resistance now, but still, what I can tell you, when your body gets toxic, soluble, fat soluble, water soluble, they tries to evade the this one toxins from damaging the other organs. That's a reason they start accumulating fat around this one. So this is a standard solution for pollution is dilution. And what are the things which we are dealing with is definitely some things like organochlorines, dioxins, PCBs, so many things we can always, I can go on and on. So what happens if I tell a overweight person, okay, Baba, you have to reduce 10% of your weight to see that you get into proper this one. But somewhere, once they start losing the weight, all the toxins they start getting out, and you get into it. Functional medicine, hats off to this particular concept of functional medicine. The history is important, as well as physical exam. I don't have to do everything. I need to look at the markers. You have got acanthosis nigricans. I know he has a pre-diabetic kind of thing. So many things which we have learned in functional medicine. So we started raising our concerns about what is this rising autism, diabetes, and all that. We are able to go to the policymakers, and yes, there are still things are there, a lot of hurdles. Coming to chemical cause of diabetes, we have device. I can always work it out on three, four things here. The three, four things are basically mercury, inorganic arsenic, cadmium, bisphenols, POP or pesticides and all that, as well as phthalates. We'll go look into what is this thing called, why this doctor is always on this thing called EDCs. EDC is endocrine disruptor chemicals, which are mimics. They mimic something like hormones. It can be, so we are talking about a lot of mimicry happening here. It's called molecular mimicry. There are some things called xenoestrogens which are causing a bigger. And yes, you see very commonly tin bottles. We see very commonly fruits which have got. We tell, okay, this is the imported fruits we have got. But I can tell you, everything is you are paying a price for that. So what you do to avoid them? You can always work out on that. I can this year I can all these things. But the most important things, PCBs, DDT. DDT is one thing which was banned, but now the DDT is still found in the breast milk. Heavy metals, I have been working a lot, as well as the plastics and all that. The endo Now we have to raise a different level of things. We have to work on, Dr. Preeti, and I know you have such a good social this one. So I want doctors with social responsibility should start talking about how to, the way we started talking about no smoking. There used to be like that. Now people have to understand what is this plastic. It's the most toughest thing to remove from the earth. And the things is, it has issues like anything. I'll again go back 30 years back, what we had, what now have, we have got. We have the change, the things which I believe, there's a school of thought, the way we started consuming water. Now we consume the water not in the glass bottle, we try to consume in the plastic water. Well, microplastics, they leach, right? Apart from that, the water what we consume is getting from, not from the surface. You get from the groundwater. Groundwater is 100, 500 feet deep, and it has got levels of heavy metals. So now I have never seen 35 years back any big bore wells in the thing. Now we see that is every flats and all that, we see bore wells. We had never seen something like air fresheners and all that, that kind of time. We have never seen that kind of what shampoos which have got high levels of phthalates. So this is a big kind of thing which I think it has to be taken up by the public. It is not just the doctor's job. You have to start looking at why the things are getting so see this particular thing. You are seeing a lady who is a pregnant and she's smelling that particular thing. It could be really poison for the kid. And these are the phthalates which are found everywhere. I can always we tried working, Dr. Preeti, we tried working on fridge. I used to tell my patients to give me a picture of what are the contents you have in the fridge. So now we should ask them what are the other surroundings. Also, we should take the screenshot, because once we see what is the thing is there in that fridge, we can always tell you what is the kind of metabolic things they are up to. Yeah, that makes a kind of thing. We started collecting this fridge shots. Good work by one of the Dr. Rangan Chatterjee, and plastics are there everywhere. So this common hormone disrupting compounds is the one which we need to work it out. I'll give a simplest example, formaldehyde and how it is percolated throughout. You go to any shopping mall, try to work on something called garment shop and all that. And after 20, 30 minutes, you don't even walk for, you feel so exhausted and you feel so tired. And invariably, you need to go to some, you go for some snacks and all that. This is because of the outgassing of that formaldehyde. Formaldehyde is sprayed heavily to make the cloth. Usually, it is used by this industry. It looks like a fresh this particular stuff. So this human exposure is quite significant, and where we are not even living everything, even on fruits also we are trying to put some sprays and all that. It's really kind of thing. So I'll come to one particular thing which was authentic, which is called veteran study, Vietnam veteran study. And there were two groups of people who fought in Vietnam War. Some of the group called were using ranch handlers. Ranch was a explosive, and with that there was a thing called dioxin was emitted. And the people who didn't use this particular agent orange, they didn't get into rabbits. Other people got into that. Dioxin is the most horrible stuff now. We the next to BPA, next to phthalates. Phthalates is one thing. We know everywhere it is percolated. Even the tooth, what we are, you have that particular stuff. You put some plastic. That's also phthalates here. So BPA concentration was measured in a lot of conditions. The significant part was in the diabetes and coronary heart disease. It's quite high. You need to learn something from there. POP, I'll not go for it, but I can always tell you if you are doing something in your home, trying to put a varnish paint, also trying to see that your furniture gets rebranded, you're refurbishing that, be careful because this is going to cause a big issues with you. The people who doesn't know about beds and all that, you have got Scarlan mattress, everything is good on paper, it looks good, but it keeps on outgassing something like PBDEs, and that is for a 8 hour thing. You sleep for 8 hours and you are in for a problems there. And like that, environmentally, I have already told you about this particular dioxide. We need to understand something about the periodic table. I am trying to put up, Dr. Preeti, one thing called magnesium. Magnesium has got a 12 valency. It's called atomic weight. And this is one thing which is at the nidus. If you understand what is magnesium, then you can understand the whole thing. There are some heavy metals down the lane which are heavy in the sense transitional metals and all that. So everything is something like biological mimicry. You have got lead in the same this one with magnesium and calcium, and you have got so there are so many metals which are playing a havoc now. The most important, in particular India, is lead and aluminum is the one. important thing. I'll show you why this mercury is causing, how it is causing that. Uh, Diabetes, you have to go back to insulin molecules. You have got what you see, the yellow thing here. These are called the disulfide bridges. You have a short arm of insulin, and you have a long arm. These two are connected by this disulfide bridges. See, these disulfide bridges will be easily knocked off by something heavy metals like mercury sulfide. It catches, it tries to. So mercury, cadmium, aluminium, particularly arsenic. So these insulin molecules are directly assaulted. So as the insulin receptor site. And this is the one thing which is one of the basic reasons you get into low. This is the reason for the present pandemic. Already 2006, American Chemical Society established showing that methyl mercury has got something to do with the pancreatic cell apoptosis. So we don't have to do more studies and all that. Already it's there on this one. So it is blocking that transsulfuration process. Apart from that, we have something like arsenic, lead, and all that. More or less, they go with the same kind of thing. Cadmium is important because I know about this cadmium here. We are in Andhra Pradesh. We have a paddy. Paddy is a rice. We are all rice eaters, and it paddy is grown in the fields which has got. They use superphosphate fertilizer. This superphosphate fertilizer is rich in cadmium. Rice. One more thing, rice. After you take out the rice bran and all that, you try to work in the mills, rice mills. They use something like eloxan to make the right rice more white. Eloxon
Right.
kills beta cells of pancreas. And yes, your mercury or metals can be there in your uh, tap water also. Tap water is a dangerous product. I don't think we had to be, we cannot go without telling that the foods which are soaked in water are prone to lose their zinc content. And you have got aluminum sulfate. We need to be careful about how we start. Here again, a food for thought I'll give Dr. Preeti. We started cooking rice in. I'm talking about rice now. Rice we started. There is a convenience, the kind of convenience. We started using pressure cookers. Once we started using pressure cookers, all that before that, I'm talking 35 years back, when pressure cookers were not there, the people used to make the rice in an open vessel, throw off the water, excess water, which invariably had starch. It's not just starch, it's other things also. So it is imperative to throw that out. The glycemic index can also come down, as well as any contaminants are there or goes off. Contaminants are usually, I'm talking about aloxan and all these heavy metals. So nowadays, what we have forget all the things. We will just put that kind of thing and OCD aa jayegi, ho gaya. We are taking everything inside, and that's one of the biggest reasons what I believe everyone is mid rare. Arsenic in water may cause diabetes. It has been proved in American Medical Association journal. And yes, low levels. They studied up to 8 to 10 micrograms per deciliter. It's up that level. And they showed this was you have got a lot of industrial chemicals causing that. You have got plastic chemicals. I have already told. But this paper, Michigan paper, they said arsenic and diabetes at about 10 micrograms. And there was a correlation with diabetes, kidney disease, and cerebrovascular. This is
Also, there is
so.
a correlation, Dr. Praveen, between arsenic and breast cancer.
Yeah, definitely. Aluminum, you're absolutely right. So, I think you have to start looking at this way. If you are heavy, it's not just, and you are sick and tired, and you are aged prematurely. You need to look at what is your heavy metal content also. So, I think I'm repeating this. Yes, one thing I want to make it very clear here is about this particular stuff. This arsenic thing was used in poultry to increase the muscle mass of chicken. I'm very sure when I'm talking about something like in 1980s, we never used to have broiler chicken. We used to have only country chicken. Broiler chicken was a big thing, and it used to be it was not easily available. Now everything is broiler chicken. Broiler chickens are being fed with this growth stimulant called roxarsone, which is used in the poultry feeds, and there is arsenic into that. Two big things, doc. I think arsenic as well as uh, exposure to diabetes. You have got a Sweden case, you have got a Bangladesh case. Sweden was the smelters, it's called. Basically, it's called glass. People who make the glass, they were at increased risks because of this arsenic component. I was talking to you about Alexon studies. Um, okay, good and bad fats. I think Ashwini, you people talk in a very good way. I don't have to add anything there, but I can tell you this picture. What happens is that you have got a blood sugar, it's there in the extracellular. Glucose in the cell is a normal thing because of the permeability of the cell membrane. And once you have got saturated fats, in the sense trans fats, this permeability of the cell membrane is lost, so the inward entry into the glucose is a issue, as so as the mitochondrial issue. So this is whatever is we are trying to work it out. A policeman's approach doesn't look good. The stagnated public crowd. You are living at this place and telling, okay, you block the other place. This is not the answer. We are not interested in just showing the glucose HbA1c normal. The thing is, there should be proper uptake into the glucose cell, and there should be proper mitochondrial this one, and the person should be healthy. Muscle uptake should be good. I'll just give you a small this one about what is this muscle uptake, what is this fat uptake this doctor is talking. Sweeteners, aspartame, and all that. Never go for this. This is a one thing which is already causing a big issues. GM foods, we keep telling everyone not to go for that. Monsanto's food, try to be careful about what is this genetically modified foods are there. Soft drink, again, it's a big issue. That's the reason we started taking the pictures, asking the patient to give the picture, because invariably you pick up in my fridge also, I'll be having some Coke or soda, something like that. So, but this is what we need to. Already it is proved bisphenol in plastic causing 1300% increase in fat cells. So this is a quite dangerous phenomena, and it has been proved that this is what causing this. Phthalates are found in so many things. I don't want to bore off in that particular thing. I'd like to give an interesting thing. I was told about uh, diabetics in kids. What we are seeing this is called insulin resistant diabetics. You have to start looking into why this phenomena is happening. There are so many things which is causing palates and all that. It is crossing the placenta. Not just after that, it is causing children with anti-androgen effects. It can easily measure, but you don't have to take all the things. By clinical methods, try to check the distance, anogenital distance. And if the anogenital distance is the issue, we are sure we are dealing with this kind of things. And yes, these kids, they get into problems. They'll hypospadias, they'll have so many other things and all that. Chromium deficiency was known, doctor. You know, all of you are working on that. A word of caution about chromium deficiency, because chromium is found in trivalent as well as hexavalent form. Trivalent form is good for your diabetes, whereas the hexavalent cause form is going to make you cancer. So you need to be careful. It is all I think this word is repeating. Whenever your body notices that sugar is elevated, sign that you have got more than you need. So the insulin comes into picture, tries to take away and store it in glycogen. So the glycogen stores in your liver and muscle don't won't last for throughout, and is so that from there it goes into the saturated fat. Insulin, we know it's an anabolic hormone. We can always improve our muscles with insulin, but it stores magnesium also, excess nutrients also. So if your cells become resistant to insulin, you cannot store magnesium. You start peeing it off in the urine. That's the reason people start going for low every time. And intracellular magnesium is one thing which is absolutely depleted in most of the people now. So that is one thing which is causing in rise in BP, rise in other things.
Extremely important for the overall balance in the body, Dr. Praveen.
Exactly, because what happens is that as a clinician, I'd like to check only serum magnesium is 1.3, 1.4, it's fine. No, it is not like that. Intracellular magnesium is a different entity at all. And if you keep your intracellular magnesium, you are not going to get into some kind of stupid cardiac arrest, the kind of stuffs now, what is being. So I have a question, Dr. Preeti. This should be a kind of they should get some food for thought, because a lot of my patients also told we are going to see that why this heart attack happens only in the middle of the night, early in the morning. Most of the corporate hospitals who are having an emergency, they're busy at that time. Morning times, afternoon times, they are not busy. The reason is your carbohydrate meal. You have to tell our people, kid, Baba, don't take that heavy carbohydrate meal in the night. That will save you a heart attack.
But that's
We
all
have
what we all do generally.
exactly,
Night,
exactly.
you tell your patients don't do that, and they say that's the only time we eat as a family.
No, no, but they need to get smart, because what happens is that it is really causing high insulin surges, and this high insulin surges, this is causes a lot of spasm in the arteries. Even if you have not any blocks also, and you have got a big spasm, you are out for a problem, you are out into a big issue. So this is what has to be done. Somewhere I believe that the higher the insulin, the bigger the damage. Now we are checking something like markers for sudden cardiac death. The markers are usually HDL levels are low, insulin levels are very high. If somebody is having fasting insulin levels above 30, you need to be careful, because you are in for a problem. So try to keep your fasting insulin levels below 10 or 7. That's I think IFM
Seven
also
is
promotes
what
that.
we aim at. Yes.
Exactly. So these fat cells, when they become resistant, so what happens is the retains the action of insulin on your fat, is there is a issue there. To store that fat, it takes sugar. So resistance goes up and up like that. Your liver starts having fatty liver. So your fatty liver, for us, we thought it is because it is down regulated. It's a vicious cycle with your cholesterol, with your insulin levels, and your toxins, which is making the fatty liver. It's an endemic, and all these things. Unless I picked on a paper which showed, yeah, this is quite everything is fine, but high levels of insulin in the blood causing this particular thing. You can just 1 second. This is yeah. This is done by Dr. Cruz into a femoral artery of a dog. I have done a lot of peripheral artery diseases cases. Usually, I don't get normal diabetes. Whenever there is a complication of diabetes, like a, peripheral artery disease, cardiovascular, or some other things, we come into picture. So we used to do that hyperbaric and all that, but somewhere this is a big thing for us. Dr. Cruz in his early 70s, he injected in the femoral artery, one femoral artery, uh, insulin, and it almost occluded within 3 months. The contralateral side, which was not injected, was quite clear. So nowadays, I see people having 70, 100 fastings insulin,
Yes.
and
Yes.
those are the people, they have invariably have a vascular disease. The fact that high levels of insulin causes blood to clot too readily, and causes the conversion of macrophages into foam cells, and they accumulate as the fatty deposits. No rocket science. We don't have to blame only cholesterol, and all that. It's insulin. It is a sugar, which is the most dangerous product on earth now. It is once we talk about sugar, we talk about insulin. We have to talk about plastic also. And then we need to talk about arsenic. We need to talk about other things. It is not the other way around. We are just trying to see that okay, there's accumulation of fat, and right, accumulation of fat is a productive mechanism by the body. Just by reducing increasing atorvastatin from 20 to 80, or people are using 160 also, it is, I think it is, you are killing the patient. Maybe that is my kind of thing. So 25
But
years before, I had always says, I would not have said before also, but any chronic disease is toxicity. One important thing I just want to show you, Dr. Preeti, then you'll understand. This is called magnesium with a 24 atomic weight, 12 atomic number is 12. Magnesium is found crucial for health in the lot of, it's used in more than 300 enzymatic reactions. We see magnesium depletion resulting in this picture. A normal person going out for a work, he has a cardiac arrhythmia. Arrhythmia is because of this low magnesium in the
I had a
cells.
patient, Dr. Praveen, who was being treated for cardiac arrhythmias. Put him on magnesium over the year and a half. He had no arrhythmias.
Perfect, perfect. Because what
He
happens
was
is
just
now
normal, and I was surprised what is happening. But
that
even
is the
before you move forward, Dr. Praveen, I want to really tell viewers also that the way you have explained how insulin and insulin resistance is the cause of fatty liver, for heart health problems, it is so important for everybody to know, because as you said, most of the patients when I check insulin who come to me, their insulin now is 40, 50, 70, pp is 500, 800, 1200. And interesting is, Dr. Praveen, they have no clue why I am talking about this. In fact,
the
some of them come and say, you wasted our money, why did you do all these tests? A doctor did not say to do these tests. And I am so grateful to you that you've covered this so beautifully. Anybody who listens to this will understand why it is important and why it must be done.
exactly. I'm coming to that. We used to think that I'm getting my green leafy vegetables and I'm having a good magnesium. No, you're not. The deeply groundwater now is depleted of magnesium totally. And instead of that, we are getting something like heavy metals into that particular thing. So you need to be very careful. Magnesium is the important stuff. Magnesium can do lot of stuff, things like this. Marginal deficiency, it can see people having some muscle cramps and they think that Arey, chalega, kuch bhi nahi hai." It's a magnesium deficiency. We, as a doctor, I used to think first of Evian. If somebody comes to me for thing, then I used to think it's like sodium potassium is correct. I based on that magnesium totally
Nobody
as a
talks about it. Evian, we are taught about it,
yeah.
but nobody talks about magnesium.
We need to talk this among the public now, because this is such a useful mineral, and it is causes so many problems. And you can, once you keep that particular things correct, you don't have to really bother about that. You people having spasms, people having lump in the throat, so many factors. So why I'm telling this particular stuff is magnesium. Magnesium in turn is a magnesium is a good mineral. Good people are being sidelined by the bad people. The people who are
Mhm.
powerful lobby, like mercury, aluminium, and your lead, they are basically some gundas or dadas, and they come into the mitochondrial cytochrome, this one, and they displace this magnesium at all because they have the same valency. They say this is my seat, and this all things goes for a screeching halt, and this is the basis of why we are talking about heavy metals and heavy metals. I did some, wanted to show you some cases as you requested. This was a case of a gangrene of fourth and fifth foot. Patient was a smoker, whatever is it. MR angiography showed there's an erratic blood flow downstream. Peripheral Doppler, I did myself, and I showed there is a less of velocity. Even, the popliteal, till popliteal, it was normal. Anterior tibial and dorsalis tibial, there is no flow out there. So we started doing something called magnesium. Uh, we tried removing lead things from here. This was again corroborated with CT angiogram, and we started doing this particular stuff. Added some things called ozone, and this was the picture. Within 3 to 4 months, all this microangiopathy was gone. Even the bone had, which had issues, some osteoporosis, and this one, there was something like bone also had effect. After this therapy of doing it, taking out lead and supplementing magnesium, it corrected everything. Likewise, there were some multiple cases. So this is one thing which I believe is I think, Dr. Priti, I have done my presentation.
Thank you, Dr. Praveen. I just lost my connect with time because
I,
it
no,
was
no,
because it was
you
so nice. I was glued to the screen and my ears were only listening what you were saying. Thank you for bringing this out. I really like the policeman approach. Now, so Dr. Praveen, how do you think people can remember this and not let this get out of their system after today's talk?
Because we have some doctors also, which we are very interesting functional medicine doctors, and I'm sure all of them are looking into all this nitty-gritties. But if we can always add on some things, because everything is, see, I'm not a very everything is not into one particular thing. So I feel that we had to look at this when it comes to diabetes. I have not gone for a one controversial thing which I would like to tell here is we are infantile diabetes. We have correlations with giving some vaccines, something like Haemophilus influenza, something like hepatitis B vaccine, and that is resulting in insulin dependent diabetes. That is one thing. Another contentious and all that is again you have got uh, but you need to look back. You cannot just say, look at that as a doctor. Okay, I'm just treating diabetes. You try to see is I'm happy with all functional medicine doctors here because you have to see the microbiome. You people are doing that. You have to see the other things also. What is hypogonadism? What is the low testosterone levels are causing this middle-aged people getting into all diabetics? You need to look at all the perspectives. Don't close your mind. Try to work on innate immunity, all things. Try to see the what is the correlation with COVID. This is a big thing now. Pre-COVID and post-COVID is like AD and BC for us because the kind of patients what we are getting, almost all patients are with that stupid jab. They are into their lymphocyte count has totally changed. It
Totally
has
changed.
it has gone totally. Your monocytes are on the high. Lymphocytes goes sometimes below 15 or it goes above 35. Both things are a cause of problem. And if we are not able to correct that logistics, whatever we do, we will be just doing some. Okay, today is okay. This is fine. I'll add this also. I'll try to add
And
a new
banded
drug has
work.
come. You try and come on, I will give you insulin. Insulin, Baba, like, look at that. What is his fasting levels? If his fasting levels are already high, why do you want to give him more insulin? You are going to kill the patient. At least he will be definitely, he will go to a vascular surgeon after that.
Dr. Praveen, what you just said, I'm reminded of a girl, 22 years old. She came to me about 3 weeks back.
Hmm.
Her doctor had said that she's moving towards 1.5, type
Mhm.
1.5 diabetic, right? Parents were extremely stressed out, and one of the health coaches, functional medicine coaches, only referred her to me and said, Dr. Preeti is the person you can go to because this is risky. I saw her monocytes, lymphocytes, eosinophils, everything, and you won't believe. Started working on her gut health, SIBO, C4 parasites. 3 weeks down the lane, her sugar levels are between 80 and 112.
Super.
Means gut can be so powerful if you can diagnose right and if you can just tell yourself that diabetes just doesn't mean food you are eating and your pancreas. Beyond that, you need to look at. And
Yeah.
the things can really change. And similarly, for heavy metals, of course, I've learned from you quite a bit, but I see mercury and aluminum and lead. And the moment start working on it, it really, the patient starts moving in the right direction. But having said that, as I said in the beginning, it is not that all diabetics can be healed properly or it can be reversed for everybody. In some cases, the journey can be long because, as you showed, the level of toxin is so high that it is going to take lot many cycles to get us where we want us to reach. But beautifully shown. Dr. Praveen, I have a question for you. Hello,
Please.
Dr. Saxena. Thanks for shedding light on the chemical causes of type 2 diabetes. My question is how to dilute the toxins and reduce the load?
I think this is why I tried emphasizing a lot on magnesium. There are some good minerals and there are some heavy metals. The balance, it goes out of balance. The higher the heavy metals, the lower the magnesium and all that. So we can always see there is we can just increase the magnesium levels. Usually it doesn't support with oral administration. We try to go with the IVs or transdermal. Mayer's protocol is one of the magnesium protocol only. So you try to balance that. At the same time, we can always fix up something called metallothioneine. Metallothioneine is one thing which is the higher the metallothioneine, the higher the toxic load you can bear. Most of the people who has got disease, they have low metallothioneine. I'm just talking about a reserve. Your vehicle having less reserve, you are in for a immediate problems. So the same thing happens here. The other stuff what we can be done is taking out these heavy metals in a peaceful way, because it is difficult to excrete this with a normal kind of things. Whatever fasting you are doing, whatever purging you are doing, this is a stubborn things. It really holds tight to your soft tissues and it gets embedded into the bone. All heavy metal toxicities have one thing common, which is lower levels of vitamin D. Just by giving vitamin D is not going to solve. You need to slowly start mobilizing this heavy metals through some reasons. The first thing what I try to tell is try to improvise on your capabilities. Excreting capabilities, hepatobiliary system. If we can improve that, that makes a big difference. You can, because your liver is the most overworked organ. Try to give support that particular stuff. Try to see that your skin starts breathing. Skin starts breathing. I mean, your skin should start sweating, something like that. The people who sweat more, they are healthy. The people who don't sweat more are not healthy. Dr. Preeti, I can always tell you there's a difference of things now. I am talking about 30 years back. Somebody used to come with the shoes, and he used to remove his shoes outside. And if he was coming after removing the shoes with that moje, what we call socks, the whole room used to sing. We used to tell, "Arey, what?
Right.
Why you have come?" We used to tell him, "Go and remove those socks." Now we
Doesn't
don't.
happen.
Doesn't happen. We are not able to actively excrete things at all.
Dr.
That's a kind of.
Praveen, interestingly, what I've seen is that when I start, people tell me that we don't sweat at all. And I tell them take 10 FIR, far infrared sauna
Absolutely.
sessions. After
Absolutely.
that, we will talk.
Yeah.
After 10 or 15 sessions, they start sweating even inside the sauna.
That
In the
lipophilic
beginning, if I
toxicity.
don't tell them you won't sweat, they feel as if there was no heat only. Because our body is just not detoxifying. Very, very beautifully put, Dr. Praveen.
Yeah.
Very
So
beautifully put.
So that is the one more concept. You try to see that your skin breathes. You are trying to do your fatty liver has to be corrected. I'm very sure I have challenged. It's not challenged, but I have seen people who are a masters in hepatologists and all that. They say you cannot treat fatty liver, but just by what you said, doing a sauna and doing this kind of things, trying to use some niacin, trying to use some good stuff, your fatty liver is getting normal. So once you
Completely
do,
normal. Even
yeah,
fibrosis cases, we are getting such good response, Dr. Praveen.
exactly. So try to use all the modalities. Keep your detoxing skills. I'll tell you your body. If I want to tell you about detoxification in a nutshell, imagine your body is like a tub. You have a tub where you used to immerse water and used to lie down there. Still, because of now people doesn't have. In the tub, we have got on the right side you have got some tabs. On the left side you have got some tabs, and you have some drains also. So your health is like a bathtub. All toxins are coming from the left side. All clean water is coming from the right side. Just imagine. And what happens is that with these toxins, it is getting overloaded and there is a spillage. The drains which are there, you have got four drains. One is your skin, another one is your kidney. You pass from pee. Other thing is your poops. The fourth one is your lungs, and that is blocked. You are in a problem. So try to cut down. Pour the normal right water. Don't pour the bad water into that particular thing. Keep your detoxes clean. It will be a good. You will not get into any chronic diseases, as far as I understand.
Feel different. Dr. Praveen, you just said one thing before I take the next question. You
Yeah,
said something like oral magnesium does not work as well as IV magnesium in form
yeah,
of mere
yeah,
toxin
yeah,
and all.
yeah, yeah.
Second, you also said that there are ways to remove toxins. But what I understand is again, we have oral medicines as well as IVs. So, your opinion on this for both?
The thing is, I'll take up first magnesium basically, because what happens is that when you have a when you are into a disease state and you have got a real problem, you have got arrhythmias and all that, you cannot depend on 15 days oral medicine to get to that level. You don't have that 15 days. So try to work on something like IV parenteral, number one, most easy thing. Yes, magnesium. Transdermal magnesium works wonderfully. I can always vouch for that. Transdermal magnesium has to be taken in a big way. Oral tablets are there, but it's more of a marketing gimmick, I think, because most of it is passed out. The more you take, it passes through the your poops. The other one is regarding heavy metal toxicity treatment with the chelation drugs. Chelation drugs are easy, but there is a lot of natural chelators also are there. Start looking at that also. Do mix and kind of both. Again, when we talk about a person who is diseased, who is having a fatty liver, so already liver is overworking. By giving orally, it goes from the first pass, it goes into the liver only. I don't want my liver to suffer unnecessarily. Even if it's a good stuff, it is going there and it is getting into something converted into some other stuff thing. So I try to see that as far as possible. I try to see that, ask them to swallow ask them to see that chew it. Sublingual medicine is better than the oral medicine. So I'm not big fan of orally. IVs, they do phenomenally well. Yes, on a longer run, if I want to keep someone, you can always do some oral stuff, because this ethylene EDTA, what we use orally, that PK value is very low, and the absorption is it's as good as not taking it actually.
Also, what I've seen is that with IVs, it does multiple other things, like it breaks the biofilms.
Yeah.
Um,
But,
and that's
but
where the healing starts at a very different level.
yes. Absolutely, absolutely, doc. Absolutely, doc. And you need
So,
to support the body. The thing is, you remove the obstacles and support the body starts healing by itself. That's kind of the beauty of that human body.
great. Thank you, Dr. Praveen. I have last question for you before I let you go, though we've extended our talk today, but it was phenomenal, phenomenal, phenomenal. What is the
No, no,
top cause of insulin resistance, energy toxicity, environmental toxicity, stress, or genetics?
what was the question like?
What is the top cause of insulin resistance?
Uh, the thing is, top cause of insulin resistance is I tried to show on that kind of picture, because that was I have given you two arms of insulin, which is disulfide bridges, and there is a even the insulin receptors have got something like pyruvate kinase. So most of the people who has got pyruvate kinase, it has also got sulfides, and we are firm believe in the sense it is not just the lead or arsenic. It can be there are other things also which are called endocrine disruptors. Bisphenol A as well as the phthalates has to do a big thing. I believe I want to give four answers. I cannot tell only one is a issue. There are a spectrum of cases. Like it happened in something like Blackfoot disease of Taiwan. What happened was in Blackfoot disease of Taiwan. This was in way back in 1977. The people who started having Blackfoots. and all of them were diabetic, turned diabetic. And it was found that the people who were taking from a well in Taiwan, that so only those people who were consuming that water, they had that black foot. So then it was tested, arsenic was way beyond. In that case, it was only arsenic. That's the thing. In I know Bengal and Andhra Pradesh and all that, arsenic in Hyderabad also it's quite high. I don't know about the other kind of
Quite
stuff.
high. Yes.
Yeah.
In north side, lead, aluminium, very, very high. Even we have a lot of fluoride here, because of which iodine is going down because it gets replaced. So thank you for bringing this awareness, Dr. Praveen. Thank you everybody for joining. Thank you very much. And do write to us about what more you would want to learn. And I will catch hold of doctors like Dr. Praveen and get you all the information. Thank you.
Th- Thank you, Dr. Priti. It was splendid. You were always a tough examiner, I think.
Thank you, Dr. Praveen. Thank you. You are a
Thank
smart
you.
one.
Thank
Bye-bye.
you. Thank you.